Good evening, everyone, and happy 21st of May to everybody. We're here tonight for another session with the Catherine McEwan Foundation, so thank you to them all for putting this session on. And I'm delighted to be joined tonight by two of my good colleagues from across the country. Okay, we're just waiting just now, just for people to join. Hello everybody, I hope everybody's doing well today, and we have an event from across the whole of Scotland tonight. So I'm Richard Russell, I'm one of the consultants in Edinburgh, and we have my colleagues Hazel and Costas, one in Glasgow and one in Ayrshire. Everybody's here tonight, and our special topic for tonight is diet and IBD. So I'd like you, just before Costas and Hazel introduce themselves, just to think and start to bring in your questions now that you have on IBD and diet. I know from all of the clinics that we're in all of the time, this is a very important question to patients, children and families. So please, this is your chance to ask us whatever question you want, and we'll do our best among the three of us to answer your questions. So without further ado, I'm going to ask Hazel first, just to introduce herself and tell us a bit about where she works and what she does. Hazel?
Hi everyone, good evening. My name is Hazel Duncan and I'm a paediatric dietitian currently based at Crosshouse Hospital in Ayrshire. Prior to my post here, I was based at the Children's Hospital working with the gastro team for about 10 years, looking after boys and girls with IBD. So hopefully I can answer any of the questions that you've got for us later on during the session.
Thanks, Hazel. Costas.
Hi guys. So I'm Kostas Gerasimidis. It's a very long Greek name. So I'm one of the senior lecturers in clinical nutrition at the University of Glasgow, and with Richard and Hazel, we've been studying over the last, I would say, approximately 15 years, the role of diet in the onset and management of inflammatory bowel disease, mainly in the management of Crohn's disease. So over the past year, I think we developed a new diet. You may have heard about that. It's called the CD3 diet. And at the moment with Hazel and Richard, we're running a couple of clinical studies to explore the effectiveness of this new diet to improve the symptoms and the gut inflammation in adults and children with active Crohn's disease.
Costas, I think you're giving away some of what we might want to talk about later, but no scoops too early on. Okay. So if we're just coming to you, first of all, about diet and IBD, what do you think the important things are for children and families to know about diet and IBD? So Hazel, I guess the commonest thing you might get asked about is liquid diet for patients with Crohn's disease. So what would be your top tips or common questions that you get from children and families while they're on liquid diet?
So I think while the children are on liquid diet, they have lots of questions, but we get a lot of questions from before when they start, when we introduce the concept of liquid diet, and families quite often feel anxious about how they're going to manage to support the young person and themselves through this. And I think it's really important that we have an open discussion when we start patients and their families on this diet therapy to make sure that everyone's on board and everyone understands the importance of the diet and why we're asking the young person to give up eating and drinking solid food for 8 weeks, because all of that will help them be able to adhere to the diet and will make the young person feel better sooner.
Okay. That's great. And what are the common problems at the start that you think? So of the people who start on liquid diet, how many get to the end? Because everybody, when they're told they have to give up their diet, their normal diet for 8 weeks, thinks they won't manage. How likely are they to manage, or how often do they manage to do it?
So a large percentage of the young people will manage to do it. About 80% of people will successfully complete treatment, and the majority that don't complete treatment is because the treatment doesn't work for them, not because they aren't able to stick to it. It would be a very small number who wouldn't be able to complete it because they weren't able to do it with the support of the team, the dietitians, the nurses and the doctors. Then they should be able to hopefully finish the treatment effectively.
Okay. Yeah. Please send us in your questions so we can ask all of the questions that you want answered. Kostas, do you want to start just by telling us a little bit about CD Treat and what that's based on?
Yes. So first of all, as Richard and Hazel said very briefly, so we know that diet is very important in the onset and management of patients with Crohn's disease. In the past, we looked at the role of genetics. We thought that Crohn's disease was a genetic condition. Now we know that obviously patients are a high risk. People who've got relatives with patients with Crohn's disease are at a high risk of developing the condition. But of course, genetic factors do not explain why people develop the illness. There's a lot of interest about the role of diet, and the main reason this is happening is because we have observed a very rapid increase in the prevalence of Crohn's disease over the last 30 years. In one of the studies that we published with Richard and other colleagues in Edinburgh, we have shown that I think over the last 30 years, there was a 5-fold increase in the incidence, in the occurrence of Crohn's disease just in Scotland. So CD3 is a new diet that we developed in collaboration with the clinical colleagues in the Children's hospitals and the other colleagues in the Glasgow Royal Infirmary. So it is a diet which mimics the nutrition and food ingredient composition of the liquid diet that Hazel talked to you about. So it's a diet which on a daily basis will provide to you the same amount of nutrients and the same amount of food ingredients that you would receive if you were to go on the liquid diet only. At the same time, this diet affects the gut microbiome, in other words, the gut bacteria which live inside our gut in the same way as the liquid diet does. So we developed this diet because we have carried out some research pretty much 15 years ago showing that most likely this liquid diet works by changing the gut bacterial population. So,
Kostas, we have a question, and it's from Lorna Diana, and it's based on what you're talking about just now. So I wonder if you would like to think about this. So can supplements with live bacteria help? So I have seen some aimed at children and wondered if they would help Angus, who was diagnosed last year. He's on azathioprine and infliximab and adalimumab. He's already had Modulin, but unfortunately it didn't work for him.
Yeah.
So can live bacteria help? So what you're talking about is the diet works by changing the bacteria. So what do you think?
Yes, so I think when we talk about live bacteria, we talk about use of probiotic supplements. So these are essentially what we call friendly bacteria, which are meant to be good for our digestive tract and for our overall health. Now, there are quite a lot of studies in the literature which used supplements which contain these live bacteria, but we know very well that in the majority of these studies, the results were negative. So in other words, if you give patients this live bacteria, the bacteria will not improve the symptoms of children with active Crohn's disease.
So what do you think about people who are buying live yogurts and other things? Are they likely to work, or that's for you and for Hazel? You can answer first.
Yes, so for Crohn's disease, we have good evidence to suggest that they will not work. For ulcerative colitis, there are some studies which show that they may work in certain types of patients with ulcerative colitis in remission. But obviously, there is need for more studies in order to make firm conclusions. So I'd like to cut long story short. if I've got a child with active Crohn's disease, as is with Agnus, I would not use these probiotic supplements because at the moment we haven't found the right type of bacteria that we need to give to children with Crohn's disease.
Okay. Hazel, what do you think about that? Live Yakult drinks or yogurts with live bacteria in them?
Yeah, I'd agree with Costas. There isn't the evidence that they are beneficial in children with Crohn's disease. They won't do any harm. So if a patient wanted to supplement with them and use them, then that's absolutely fine in addition to a normal balanced diet, but it's unlikely to be beneficial in helping manage the Crohn's disease.
Yeah, so the problem with most of these is that there aren't enough bacteria in the food, and even if there is, it doesn't get to the right place in the bowel often. So that's great. We have another question for Rihanna Lewis. How could diet help with reflux associated with IBD? Hazel, do you want to try with that one?
Yeah, I think the diet can help, depending on the changes that you make to the diet, can sometimes help improve reflux. The majority of the patients that I see are pediatric patients, so we would probably use the exclusive enteral nutrition, and that may help settle down the inflammation in the gut and improve reflux symptoms at the time of an acute flare.
So yeah, thanks very much. I think sometimes with reflux, you can have reflux which isn't related to IBD as well. So the type of things which will make reflux worse are very citrusy foods, very fatty foods, foods where you're taking a large volume of food at once, and then there are some specific things which have vinegar in them, like tomato sauce. People often find difficult with reflux too. So I'm not sure if any of that helps. That advice. I'm not sure who this next question is for, to be honest. I don't know the answer to it, but maybe you guys do. So Morag Dalton has asked us, what do you think about kombucha drinks and effects on IBD?
I can answer that.
Good, Costas. Thank you very much. Thank you very much for the question. That's what I was going to say. Thank you for the question, hoping somebody else would answer it. So thank you, Costas.
I think kombucha is a very interesting concept. It belongs in one of these categories of fermented food. At the moment, we have no studies which have explored the efficacy or the effectiveness of these drinks on the management of Crohn's disease. So similar with probiotics, we can take them. Most likely they will not give you any benefit, but they can have other positive kind of like for your overall gut health. But when it comes to the management of Crohn's disease, we have no studies which have explored, which have investigated the effectiveness of these products. But I understand they're very popular. People love them. They're not very tasty, so my wife drinks them. I don't like them personally. But when it comes to Crohn's disease, I don't think we have any studies to suggest that they are of some benefit. Okay,
so exciting prospect maybe, but nothing firm at the moment.
Yeah.
Okay, next question. Thank you, Lisa Cook, for your question. Hazel, this one's coming for you. So my son is 14 and was diagnosed with Crohn's disease when he was 7. He started on modular and managed the whole treatment, and his weight improved. He's struggled since with weight gain, although his height has gone up. Would the liquid diet help him? He is on azathioprine and adalimumab.
All right, thanks for your question, Lisa. So I think the liquid diet used out with a flare of Crohn's is a really difficult thing to do. So we wouldn't advocate it unless a child is in a flare and is unwell with their Crohn's disease. Whether your son would benefit from some nutritional support from their dietitian to see if their weight can improve. But if he's growing in height, then that would suggest that he probably is doing okay. So it would just be making sure that he's eating regular meals and having high calorie and high protein foods to supplement his diet. There are some patients who would use nutritional supplements with, and that would be decided on an individual basis after a consultation with a dietitian.
Mm-hmm.
That's great, Hazel. And I think additionally, what we would say is often when children are going through puberty, they will often put on height or weight, but sometimes don't do both. So it's important just to keep a track of things, but not be too worried if your child's suddenly growing very tall, but their weight isn't going up very much. but supplements can often be needed just to give you that extra boost during puberty. And very occasionally, feeding tubes and other things can be used. So it's not liquid diet just by itself, it's liquid diet with normal diet too. So another great question. Sorry, Costas, I've got a question for you now.
Okay.
So thanks, Ruth Wilson, for your question. My 29-year-old son has Crohn's disease. We live in Glasgow. How can he access more information about this new diet?
Right. Okay. So we have actually created a website which is hosted in the University of Glasgow domain. So he can find more information about the diet there. He can also contact us about the diet, so we can describe to them what the diet is. And if the patient is looked after under one of the main adult hospitals, like the Glasgow Royal Infirmary, the Glasgow General Hospital, or the Queen Elizabeth Hospital, he may even discuss this diet with his consultants. And if he's eligible, he will be even offered to participate in the study. So there is not much information about the diet itself in the public domain, because obviously this is an experimental diet at the moment. So we have seen some positive results, but we need to do further research to make sure the diet works. But if anyone is interested in finding more about CD Treat, I will be more than happy to answer any questions they may have. At the moment, as I told you before, there is a website dedicated for CD Treat, so there is some information on this website.
Great. So, Ruth, I'm sorry if I gave your son's ages wrong. I think he's 20 rather than 29. We do just need to say that the dietary treatment, CD Treat, is part of a clinical study at the moment. So it's not available for anybody and everybody. We are excited about the results, but we don't want to prematurely start to recommend something in standard care when we're not absolutely sure of it. So we've used it in 20 or 30 patients so far, maybe
38.
38, okay, so nearly up to 40. While the pandemic is on, I'm afraid that nobody is able to go into dietary trials at the moment. So the government and the universities have all stopped our research work, which is including the diet work. But we hope to have the studies up and running again very soon. So as soon as we get the green light from Nicola, then the studies will be back on. But you certainly get him in contact with his local IBD team and they can give him more information. We have another question here. So from Sharon Douglas about her daughter who's about to go to university. Any suggestions about IBD student life and diet? That's for both of you. Thank you for the question.
I don't think we've got any firm data to make data recommendations for patients with active Crohn's disease or Crohn's disease remission. I think if your daughter keeps the same dietary habits as is had back home, this is good, okay? But I don't think that even if she changes her dietary habit in a more kind of like student lifestyle, I don't think this will necessarily affect their symptoms. I think the most important aspect is to listen to the advice of the clinical team, both when it comes to the medics as well as the dietetic team.
Hazel, you want to add anything to that?
Yeah, I guess it's just making sure that she's well prepared and that she's able to cook herself and can start to maybe over the summer months do a bit of education around healthy meals and how to cook, and making sure that she's well versed in that, which she may already be, but some young people aren't, and that she has access to the necessary equipment to do that while she's there as well.
And I think also looking after your weight, so basically monitoring your weight is a very important aspect here.
It's true. Good routine, I think, is the main thing. So another question here. Thanks for all these great questions. They're testing Costas and Hazel, testing their knowledge. So this is from Rhiannon Sharp. I'm 23 years old with active Crohn's disease, but have been on 2 different types of steroids for the last 12 months and gained a lot of weight. What can I do to help with, please? So Hazel, would you like, this is a very common question that we get from patients after they've been on steroids?
Yeah. Hi, Rhiannon. Thanks for your question. You will get some weight gain with steroids. The important way to try and reduce that or limit it as much as you can is to stay as active as you can during your time on steroids, and ensuring that you're active following that, and also to follow a healthy meal plan, eating 3 meals a day, keeping snacks to a minimum, but ensuring that you use low calorie foods to snack on, and that you're monitoring your calorie intake and you're not eating excessively.
Great. Costas, anything you want to add?
And just try to exercise a bit more, particularly as we know when patients get better, so they spontaneously start losing weight after treatment with steroids. So I think the most important aspect is, first of all, to control disease. If the patient gets in remission, we know that spontaneously people start losing weight. And in addition to the eating habits and healthy food options that Hazel mentioned, it will be advised also people to become more active, which again, things are becoming kind of like better when patient feels better. So the physical activity again increases.
Yeah. So I think we all recognise it's a difficult time when you're on steroids, but the effects, we can say are short-lived. And, although the weight gain comes with the steroids, it does leave fairly quickly afterwards. And, regular eating and exercise as much as you can based on, how you're feeling and your disease and everything is very important. Okay, we have another one. So Kirsty LB, thanks for your question. Our little boy is 5 years old and has Crohn's disease. He's coming to the end of 8 weeks of the liquid diet. We're keen to move on to a diet that could help maintain remission. Could CD treat be used for maintaining remission? This question really sounds like a plant, but I don't think it is.
No.
Or could you offer any other advice and principles from diet you might apply in the interim? So I'm going to ask Hazel first what we would do in normal clinical practice, and then Costas, I'm going to ask you just about research that's going on in this area.
Hi. So well done to the wee man for completing 8 weeks of EEN. That's absolutely fantastic. And well done to him. So introducing food's always quite a difficult and scary time for parents, because they worry that when they start eating again that the symptoms are going to come back. But all the evidence that we've got says that we can reintroduce a normal diet, and we can do that slowly over a couple of days to a week. So we don't do any restrictions. We introduce foods normally, and we just to say take it easy for the first few days, and then they can eat a normal diet. There is no foods that they need to avoid, but Costas will maybe expand on some of the CD treat aspects of that.
Yeah.
Hazel, that's great. I think what we're learning is that this, after you've been on a liquid diet, is a key window really for helping us understand a bit more what effect diet has on Crohn's disease itself. And Costas, if you can maybe tell us about some of the work that's gone on before and what work is planned in this area.
Yeah. So I think first of all, Hazel is very correct to say that we don't have any firm food introduction suggestions to make right now. So basically, patients are allowed to go back to the normal diet. However, in some of the research we have done in the Royal Hospital for Children in Glasgow, we have seen that soon after the patients go back to the normal diet, in approximately 40% of the patients, their gut inflammation will return back to pre-treatment levels. So in other words, although it takes people 8 weeks to get better during the course of exclusive enteral nutrition, or what we call modular diet, although it takes 8 weeks for the gut inflammation to come under control, we know very, very well that within 2 weeks, in approximately 40% of the patients, the calprotectin will go back to the pre-treatment levels. So what
people might not know what calprotectin is.
So. Sorry, gut inflammation. So calprotectin, sorry for that, is a marker of gut inflammation. So it tells us how active the disease is in your gut. We measure that by asking you to give us a stool sample. And this is why sometimes your clinicians ask you to give stool samples. For 2 reasons: to measure the gut inflammation, or to measure in your gut if you've got any nasty bugs which can cause disease apart from active Crohn's disease. Now, we have recently started a new study. We call this the IPEN study, which stands for the Intensive Post-Enteral Nutrition Study. So in this research, we try to see whether we can control the reactivation of gut inflammation after the end of the liquid diet by giving patients CD treat. So as Richard told you before, and myself, at the moment we test CD treat to make people get better. So a new study we have just started. In this study, we're trying to test CD treat as a treatment to maintain the disease in remission for a longer period of time.
So that's great. So the study is called iPens, so same as iPhone, iPad, iPens. And the same, so the study has started in Glasgow, but again, with the pandemic, the study had to be stopped after a couple of patients. So the study is ready to go, and it's for children in most of the children's hospitals over the Central Belt. So in Glasgow and in Edinburgh and in the surrounding hospitals, patients will be taking part in this study. The study itself lasts for 3 weeks, and the children will either receive CD treat or they will receive their normal diet. So this is the type of study where your choice, you don't choose which one you get, the choice is randomized. So you will be randomly allocated to one diet or the other, because we don't know at this stage whether CD treat will help in this way or it won't. But it's a perfect question, and if you come back to our Facebook Live in a year's time, I think we'll have it done in a year, Costas, maybe 18 months time.
Yeah. I think the other important aspect about the IPEN study is that we're not just testing CD treat as a treatment to maintain the disease activity. We're also interrogating what patients consume after the end of the liquid diet and when they go back to their habitual diet. We tried essentially to identify differences in the diet between patients whose gut inflammation is still low, as opposed to patients whose gut inflammation increased after the end of exclusive enteral nutrition and reinitiation of their habitual diet.
So basically what Costa said there was everybody who takes part in the study will learn important information from, and we're very grateful to the Catherine McEwan Foundation and to the Glasgow Children's Hospital charity, because they have helped us get this study started. As they've done with lots of our dietary studies, they've given us the initial belief and support and funding to help us get these studies off the ground. And then once they become established and other people have heard about the idea, then we've been able to get study funding from other people. So we're very excited with this particular study to get large amounts of money from 2 different funders, the JP Moulton Foundation and the Crohn's and Colitis Foundation from America. And this is the type of funding that we've never had before for these type of studies. So your help, the foundation's help, has paved the way really for us to be able to do these studies. So thank you very much for everybody who supports the foundation. So another question. So thank you, Sharon Douglas. Please can I also get advice about vitamin supplements for my 18-year-old daughter with IBD? Which ones would you recommend, if any? Costas or Hazel? Who would like that question?
So, I can ask first of all about the evidence to suggest whether these micronutrient supplements can improve disease symptoms. There is no evidence to suggest that if you take any micronutrient supplements, this will make your symptoms better or will prevent disease relapse. However, if your diet is not a balanced diet, so if you don't have a high, for example, intake of fruit and vegetables, and if you avoid certain food groups, it might be advisable to take some of these multivitamins. And I'm sure this is what the dietitians normally do in routine clinical practice. And I'm sure Hazel can correct me if I'm wrong.
Yeah, no, absolutely. Absolutely, Costas, you're right there. So I think if the diet is adequate and they're eating a wide and varied diet, then there's absolutely no benefit to taking a micronutrient supplement. However, if the diet's limited, or if there are certain food groups that they're not so keen on, then they may benefit. I suppose vitamin D is always quite topical, and as we stay in the west of Scotland and don't get much sunshine, even during the summer, then we may benefit from taking a vitamin D supplement over the winter months to help boost our levels.
And always bear in mind that quite often patients with Crohn's disease tend to avoid certain food groups, particularly dairy products or products which are high in fiber. So obviously dairy products are very important source of calcium and vitamin D. So obviously if you're avoiding taking any dairy products, it might make sense for you to get some calcium supplements.
So Sharon was particularly talking about vitamin D, Hazel. So
Okay.
well done for predicting that.
Or you can go to Greece for 3 months for holidays where it's...
You can't. Costas, has nobody told you there's a pandemic on?
No, not in Greece.
I've been doing too much research in the lab. So if you can share and tag people who would benefit from the questions and answers that we're giving tonight, that would be great, because a lot of the common themes that we are asked about in the clinic are coming up. I'm surprised we haven't been asked this question so far, but I'd like to ask you, Costas, in words of a non-scientist, how you think diet benefits Crohn's disease. So what are the key things that it's doing to make Crohn's disease better?
Are you talking about CD3 diet or diet in overall?
Well, if somebody takes a specialised diet, whatever that diet is, so if it's liquid diet, CD treat diet, some of the other diets, how do we think it's working? So people always ask, you know, why do you think the diet works? What can I do to replicate or mimic the diet?
Yeah. So first of all, the simple answer is we don't know how the diets work, but we do.
I'm hoping you're going to go a bit further than that.
Yes, but I think we believe that the diet works by excluding dietary components which interact with certain bacteria in our gut which cause inflammation. So, for example, we know that the liquid diet, when patients go on this diet for 8 weeks, we know very well that approximately 50% of their gut population, gut bacteria, will change during this diet. And we believe that some of these bacteria, which are suppressed during the liquid diet, may play a role in the disease onset and in disease etiology. There is a lot of interest about whether we should exclude certain types of food additives. There is some evidence and some studies with animals or some studies in the lab which show that certain types of food additives can increase gut inflammation, but all of these studies have been done in animals, and none of these studies has ever been replicated in patients with active Crohn's disease.
Okay, so from that was a simple answer, believe it or not. So
was it clear?
Hazel, you know, families often come along and ask about excluding specific things from their diet. So they're worried about, you know, preservatives or food colorings or, you know, other things which are found in processed food. What advice do you give to parents who are excluding specific things from their diet in terms of its affecting Crohn's disease or colitis?
So I think, as Costas said, there isn't any strong evidence that the families need to, or the young person needs to avoid any particular additives or preservatives. So I think with the families, it's important that we have an open table discussion and we talk about why they feel it's important and put over why we feel it's not needed. And at the end of the day, we need to have the young person at the focus of the discussion to make sure that their diet is as balanced as it can be. They're going to get everything that they need to grow and become the young person that they're going to grow into to reach their full adult height potential, and make sure that their diet is as balanced as we can. So I think we try where we can to support families as much as we can, but ensure that they're safe in doing so and that they're well informed of the decisions that they make.
Yeah, that's true. So I think, you know, we're very keen, obviously, that people take healthy and balanced diet, but sometimes going on an exclusion diet can cost you a lot of money and not be, have a particular benefit. Are there certain types of diet which are better? I know, Costas, there's lots of, by the way, on Facebook, love for Greece, and everybody's missing Greece as much as you, and they're not even Greek. So there's lots of Greek love going on. But are there any particular types of diet that might benefit Crohn's disease? So what about, for example, a vegetarian diet?
No, we have absolutely no evidence to suggest that a certain type of diet can be of any benefit for Crohn's disease, apart from the exclusive enteral nutrition that Dr. Russell and Hazel talked about. There are quite a lot of studies at the moment which test different types of diets, but we just have some early evidence that some of these diets may work. We need more studies. We need studies to be done by independent groups, and we need to sit down and analyze the data. And then when we do this, we'll be able to make recommendations. At the moment, there's absolutely no other dietary therapy for Crohn's disease apart from the liquid diet.
Okay. Hazel, do you want to add anything? What would you say for a vegetarian who came along and said, I need to change my diet because I now have Crohn's disease?
Yeah, I think if someone is vegetarian for their own reasons, then that's absolutely fine. But if it's purely because they feel it will help their Crohn's disease, then I think it's important that we have a discussion around the evidence and ensure that they're aware that the evidence wouldn't support that. If somebody wants to follow a vegetarian diet, then it's ensuring that it's well balanced and they're getting all the micronutrients that they need, and that they are not, restricting their diet unnecessarily.
Okay, and of course, you have always to remember that patients, particularly those who have active Crohn's disease, may be at risk of micronutrient deficiencies, like vitamins and trace element deficiencies. So when people start excluding more foods, then they increase even further the risk of them being deficient. So you have to be very careful and always discuss that with your clinical team. Okay,
thank you. The next question, I think, thank you for this next question. I think I have to answer this one, I'm afraid. So this is from Anna Reid. Thank you, Anna. I've been recommended a peppermint oil supplement by my consultant. Can you please explain the benefits of taking this in Crohn's disease? So if either of you guys want to take it, you can, but I suspect your consultant has prescribed your peppermint capsules or peppermint oil to try and gently ease some of the symptoms you might be getting associated with your Crohn's disease. So it's a gentle healing therapy. It definitely is very well proven to be of benefit in IBS, not IBD, but IBS. But we know 1 in 4 patients with IBD will also have some IBS symptoms. So it can often be helpful for pain or cramps or other things that you might be experiencing that aren't directly related to your IBD, but are still giving you problems. So the capsules can be very helpful. We've certainly found great help in the clinic with them. So I would recommend you at least give them a try for a month or 2 and see if they help with your symptoms.
Will they help
you guys?
No, will they help also symptoms with regards to reflux or dyspepsia?
You want to take peppermint for reflux?
Yeah, I'm just asking, will they be of any benefit?
So it's certainly a very traditional treatment for reflux. And if you ask older generations, before you had drugs like omeprazole and even Gaviscon, then peppermint acts as a gentle settler of problems, including reflux symptoms. Okay. Okay, so this is a great question. So Becca Smith, thank you very much for this. Why are we all talking about Crohn's disease and not colitis? So what is the reason for diet focus on Crohn's rather than colitis? So that's an excellent question. Who wants to start? Costas?
I can say so. We talk more about Crohn's disease because we know that exclusive enteral nutrition works. So we've got some evidence to suggest that diet is important for the management of Crohn's disease. Whereas on the other hand, we don't have any evidence at the moment to suggest that diet may be benefit for patients with ulcerative colitis. I personally believe that diet is very important too, But I also believe that the role of diet in ulcerative colitis may be completely different to the role of diet in Crohn's disease. We know, for example, very well that if we try to treat patients with active ulcerative colitis with a liquid diet, it doesn't always work. So it means that different dietary factors influence both of these conditions.
Sure. Okay. Hazel, anything you want to add into that, or?
Yeah, I think I'd agree with what Costas said. We do still see the patients with ulcerative colitis when we're in clinic, but we see them for different reasons. So we see them to support their growth and to make sure that they're eating a healthy, balanced diet. So it doesn't mean they don't have access to the dietitian. They should still have access to the dietitian, but as Costas said, we don't have the evidence to say that the nutrition will work as a treatment.
Yeah. So Becca, just to add to what Costas and Hazel have said, I think one of the reasons might be because Crohn's disease is much commoner in children than ulcerative colitis. So 7 out of 10 patients with IBD in childhood will have Crohn's disease, 2 out of 10 will have colitis. And the nutritional studies have really come from children's department rather than adult department. So I think part of it is because children with Crohn's disease were common and were there for dietary treatments, because we use diet for lots of different conditions in children, not just inflammatory bowel disease. I think the positive news is, I don't know if you have colitis or Crohn's disease or neither, but there are now ulcerative colitis studies coming off the back of the successful studies that have been done in Crohn's disease. So as Costas says, the diet that's likely to work for colitis is not the same as a diet for Crohn's disease, but those early studies are being done. And I think within a year or two, we'll start to then understand whether there are diets for ulcerative colitis or not. So I hope that helped answer your question. Here is another one for all of us, I think. So Arlene Wilson, thanks for your question. Does turmeric help with Crohn's disease? Her son was in the CD trial with Vios, so she's bigging up Vios, as we all are. What about turmeric?
I can answer that. So there is some animal experiments in which turmeric was of benefit, and I think there are also a couple of human trials. I'm not quite sure if they are in Crohn's disease or in ulcerative colitis. In
colitis.
In ulcerative colitis, in which there was benefit of patients using turmeric. Of course, these are just 1 or 2 studies. We need better studies. We need larger studies. We need multi-center studies. But once again, I don't think it will harm if people, for example, add turmeric in their diet.
Hazel, anything you want to add into that, or?
No, I don't think so. I think Costas covered all of that.
Okay, great. Okay. So no evidence for Crohn's disease at the moment. Barry Cook, how are you doing? So Barry, a great supporter of the foundation, has asked us a very good question. What diet and nutrition advice would you give to someone who's had their bowel removed? Are there definite do's and don'ts? Also, any advice on supplements which should be taken?
That's quite a big question, Barry.
Yeah, it is, and the bowel is a big place.
Yes.
So some of the answers would depend a little bit on which part of your bowel was taken away, because different parts of the bowel do different things. Therefore, the considerations about supplements and do's and don'ts do depend on that. So if we're thinking about an operation on the small bowel first, there are certainly some do's and don'ts there and some supplements to look out for. So vitamin B12 is absorbed in one of the common sites for Crohn's disease. It's often taken away by an operation at the end of the small bowel, the terminal ileum. So if you have a large area of that removed, then you should usually be on vitamin B12 supplements, which are usually given as JAGs every few months. You can also have problems because you don't absorb certain acids in that area, and that can give you diarrhea. So if you have an operation there, you need to monitor for these things. If you have an operation on your large bowel, Hazel, any particular advice there?
Yeah, I think it's very patient dependent, depending on whether they have a stoma or whether they don't have a stoma. So I think it's just making sure that you speak to the dietitian within the team, and that you get advice based on the exact surgery that you've had.
Okay. Sometimes, certainly within the initial phases of the operation, then not taking huge amounts of fibre and things in your diet to start with is often, the thing to watch out for. Your bowel is healing after an operation, so you need to take it easy. But as Hazel says, the dietitian should be there on hand to give you advice with that. Costas, anything you want to add into that? Or?
Just a comment to make that the large bowel is important, but it's not as important for your nutrition as is your small bowel. So people who have lost part of their large bowel, they are not at risk of micronutrient deficiencies or at risk of undernutrition, but people who have lost part of their small bowel, they may be at high risk. This is because our small bowel, our small intestine is very important for the nutrient absorption, whereas our large bowel is more important for the absorption of water and some other functions of the digestive tract.
Okay, great. Listen, great questions, and keep them coming in. This is just a reminder to say next Wednesday, we have an IBD nurse special with Janice Spinell, who is an IBD nurse, an adult IBD in the Western General, and Professor Charlie Lees, who is never off Facebook and Twitter, particularly giving helpful advice during this whole pandemic. So you don't want to miss that one for sure. So the next question is from Susan Hall. She's asked, can slippery elm bark help at all in colitis? I must admit, I don't know the answer to that one.
The people use it. It's one part of the complementary alternative therapies that patients with ulcerative colitis have reported using. But again, there's absolutely no evidence to suggest that it's of any benefit for patients with IBD.
Okay. So it probably won't do any harm, but I guess there isn't enough studies being done with it to our knowledge to help with that.
Sometimes we have also to be very careful when we take these supplements which are based on herb, because many of these herbal supplements may interfere with the action of your conventional drugs that you get from your clinicians. For example, an example is the St. John's wort can interfere with the metabolism and absorption of certain drugs. So you have to be very careful, and you have to disclose the use of this complementary and alternative medicine to your clinical team. It's very important, guys.
Yeah. So I think there are. When we've asked, Costas did a survey a while ago now, just asking, children and families and patients with IBD, how many take supplements or extra therapies like, some of the good ones we've heard mentioned tonight, and most families do, and that's fine. We certainly don't know all the answers, and potentially some of these things might help, but it is important to let your team know, because there is an occasional food supplement that you might be taking which might interfere with some of the other treatments you're taking for your Crohn's and colitis, or the very rare one where it actually might make it worse. So we don't know all the answers, but be transparent with us, let us know, and we'll let you know how they can help. I think this has really been a great event put on by the Foundation, and we really want to ask the Foundation to keep up the good work with these live video and web chats that we're having. Any final messages from both of you guys?
I think the message is just all ask for advice your clinical team. I think there's quite a lot of information available on the web about the role of diet in ulcerative colitis and Crohn's disease, and quite often people seek for advice from the Dr. Google, but you have to be very careful about that. If you've got an opinion about something, please discuss that with your clinical team. I'm 100% sure that your clinicians and your dietitian will be more than happy to answer any questions you may have. Just don't do things on your own. Just be very careful. I think that's
Hazel, thank you.
Yeah, I'd agree with Costas that it has to be a two-way communication between us and the family. We need to be transparent with each other so that we all know where we stand, and that means that we can have open conversations to work out what's best for the child or the young person or the adult that's at the centre of the discussions.
Thanks very much. We have 2 questions coming in at the last minute, but we do have clap for carers coming up. So I'm not saying this just because you've asked about cannabis as the last 2 questions, Tracy and Laura, but CBD and CBD oil is perhaps a good Q&A session to have. There is as much interest in that from patients as there is in diet and IBD. So I would suggest to Derek and the foundation, that's an event for a future one, and maybe not one we want to talk about tonight. So listen, everybody, thanks a lot for all of your questions, and stay safe. Remember, the webinar is on next Wednesday with Charlie Lees and Janice Fennell. Share the questions, share the page, tag it in, do everything you normally do on Facebook, and see you again soon. Thank you very much.
Thank you, guys.
Thank you.
Thank you, guys.
Bye.
Thank you.
Thank you.